Thanks everyone and nice to meet you all. My name is Peter. I'm the founder and CEO of Oben Health. And at Oben, we are on a mission and our vision is to reverse heart disease. Again, I'm sure most of people you're familiar with the problem in heart disease in the US, and I'm grateful again to be invited to be able to present the work we're doing at Oben. But just wanted to share a few numbers about what's going on. So heart disease is a $1.1 trillion problem. And not only is it the leading cause of death, killing over 647,000 Americans every year, but what's truly sad and disheartening for me is that over 50% of the people who die from heart disease are people of color, so belong to Black and brown or underserved communities. But beyond that, it is one of the most expensive chronic conditions to treat and manage in the US, accounting for 40.8% of all healthcare expenditures. And after talking to payers, providers, and people in the health system, it costs about $18,000 per patient per year to treat and manage heart disease. The three big sources of the cost are ER visits, hospitalizations, and medications. But why do I care? Why is this important? And why am I talking to you today about this problem? Well, this is something that's personal for me. So about 2.5 years ago, close to 3 years now, pictured here is my brother, Paul. And he died from heart disease with underlying hypertension at the age of 36. He went to bed and he never woke up. And this had even talking about the story right now, a profound impact on myself and my family, because not only was he a mentor, he was the one I looked up to, my best friend. And so I couldn't fathom how a 36-year-old can just go to bed and not wake up. But beyond that, the story is way too common in communities of color. We know too many people or too many young people that have died from heart disease or underlying hypertension. So just to give some context to that, we are 2 to 4 times more likely to die from heart disease. Kaiser came out with a recent study that said 1 in 4 African Americans has some form of hypertension and heart disease, and that's happening as young as 15 years old. So we've got an epidemic happening, a health epidemic. So in addition to that health epidemic and the financial burden, the question becomes, how do we solve this? How do we create a world where the disparities in heart disease outcomes do no longer exist and solve the problem there? Before trying to solve that, we've got to reconcile the fact that we've got inherent bias in healthcare, specifically digital health. There's been a massive growth in the last few years with the rise of the pandemic of digital health services that have helped create a whole new, accelerate the process. But what's missing is a majority of the population who doesn't have access to healthcare, nutritious food, stable housing, or financially well are not part of that equation. And we've seen that as healthcare has progressed, this group has been left behind. So that's one thing we wanted to do at Oben. And so here's how we solve this. The first thing we wanted to do is we wanted to find someone that's done this work. And that is our chief medical officer, who I'll talk about more in a little bit. But in the last 10 years, she's created protocols and she's worked one-on-one with patients where she's helped 96% of her patients reduce their blood pressure and 70% achieve medication reduction. But beyond that, she's lowered their blood pressure by 10 to 30 milligrams, which is significant because every reduction by about 10 milligrams reduces the chances of getting heart failure by about 28%. What we've done is taken this work that has been accessible only to a few, digitized it, making it culturally competent, and providing that skill to Black and brown heart disease survivors in our community. Here's how it works. So I want you to meet Kisha. Kisha is a typical patient that will go through our platform. She's a 45-year-old African-American heart disease survivor. So there are a few things that happen when Kisha is diagnosed with hypertension. The first is hypertension is so normalized in her community. So when her physician tells her, hey, you've got uncontrolled hypertension, and she goes back, she doesn't have the required support needed to manage that condition. I know that from experience where everyone, uncles, aunts, just thinks, well, it's high blood pressure, you're going to die from something anyway, so what's the big deal? But secondly, she's just overwhelmed by all the changes she has to make. Her physician tells her she's got to lose weight, eat better, sleep better, just you can name it all. The question becomes, well, what do I start with first? How do I begin? What's really important? And you have to mix that with all the other concerns she has of running a household. The last, which is probably the most important, is we cannot separate healthcare from the social determinants of health. Yes, you can tell Kisha to eat better, but if you don't take into account that she may live in a food desert, or that she's miles away from the closest grocery store, or the levels of violence in her community, you can't actually help her manage her health condition. So this is how we help Kisha solve her problem. When Kisha gets into the Oben platform, the first thing we do is provide a customized assessment to evaluate her risk factors. Yes, we take into account what she's been diagnosed with, family history of heart disease, hypertension, cholesterol. But beyond that, we assess her in terms of nutrition, stress management from a holistic point of view, and trauma informed, exercise, hydration, and sleep. I'll pick on nutrition just a little bit. So, from a nutrition perspective, we assess if she has enough magnesium, calcium, and potassium in her diet, which are important for heart disease and in terms of controlling hypertension. But we go one step further. We ask, do you actually cook at home? Do you have a kitchen? Are you the one who actually makes your meals? What are some of the barriers that you face to actually making the food that you need to be healthy? That's one of the first steps we take towards being culturally competent. Once we've done that, we've created algorithms that match treatment plans that will be created by clinicians on board. So as you notice here, the first thing is one of the things that ultimately solves Kisha's problem is that overwhelm. Now she has three simple things that she gets to do on a daily basis, which is enter your blood pressure, use less salt without sacrificing taste, and go on a 5 minute walk. We have multiple different activities which are all between 5 to 15 minutes long, but it's structured and it's easy for Kisha to get started. But beyond that, what's really exciting is that we have all of these are culturally competent treatment plans. So we work with where Kisha is. If all she can afford to eat or where she can go is a convenience store, we provide treatment plans to work within that because of the data we're collecting and the kind of cultural competency we're building. The image, everything from imagery to relevance, is all built to meet Kisha where she's at as a patient. The third component of this is now she's got a support group, and it's something we call secret chats, where she can connect with other heart disease survivors just like her, share questions and experiences of what it means to be a black and brown heart disease patient, her experiences with the clinic. She has access to a health coach that's local to her. We don't do call centers because we believe that's part of building that emotional trust, as well as coaching and lessons. And throughout the 12 weeks, we're looking to normalize and lower blood pressure. The reason I'm excited about this, it's a huge market opportunity. We know that about 33 million Americans are diagnosed with essential hypertension every year. About half of that number is people of color who were targeted initially. And heart disease hypertension is originally a $163 billion opportunity. We know that we are focused on the hypertension, but we're looking at moving to things like cholesterol and atrial fibrillation as we move forward. Putting this all together is a team with over 30 years of experience combined in cardiac health and mobile product development. There's myself as the CEO. I have over 10 years of experience building mobile products as well as finding product market fit in early stage startups. Carl Swanson was our CTO and AI developer, over 15 years of experience in the field. Michelle Rottenson, who's protocols, who's our chief medical officer and a cardiology dietitian and clinician with over 10 years of experience. And Megan McVeigh, who heads clinical operations. She's a licensed therapist and social worker who's worked in the last 10 years in the communities we serve. So far, here's just some little bit of traction that we've gotten over the last year and a half. We've built a wait list of about 2,500 users working with heart disease organizations in California, as well as in Alabama, Birmingham. Our user engagement after we've run 3 cohorts of our platform has been up to 75%. This is from how many users actively complete the program to log in daily to use the program. But what I'm super excited about, which proves where we're going, is we have 3 upcoming paid pilots. One with UAB Health System, the 8th largest health system. We've reached out and said, we know we have 1,000 patients with undiagnosed uncontrolled hypertension right now. We want to work with you. Roots Community Clinic, as well as Healthy Richmond and Alameda County here. And we expect a revenue from these 3 pilots of over $100,000. Why would they? And our revenue model essentially right now is by selling to value-based healthcare systems where we charge $100 per patient per month. And then moving from the initial 12 weeks, we go into a shared savings cost model in addition to the $100 per patient per month. I'll be happy to share more details about this in the Q&A. So why would these value-based healthcare systems, why do they want to work with us? Well, we know they spend $9,000.89 on hypertension medical related expenses. And I'll use one of the examples is Cooper Green UAB, which I said we have 1,000 patients with uncontrolled hypertension. The reason why that's a big problem is hypertension gets worse with every stage. And because they manage the entire cost of care and also responsible for patient outcomes, they want to bring in a tool that can enable the patient to manage their hypertension. They can't do that themselves because they don't have the emotional trust. And they need something else that can come in there and improve the patient between clinical visits. And that's what we're looking to do in our pilot, where we can demonstrate that we can save them 75% in cost savings by using the Oben solution. Our competition so far, we're really looking at being that hypertension treatment. What we have in the market are hypertension monitoring services as well as culturally competent solutions. We're looking at being that cardiovascular treatment for hypertension, which is also culturally competent and meets the patients where they are. Here's an overview of our roadmap over the next 12 months, 12 to 18 months. We're focusing on those first 3 pilots starting this summer, looking at moving into integrations. And we know that we've started talking to larger partners, which is managed healthcare systems. The data we get from these pilots will enable us to approach those healthcare systems as we grow. How can you help today? If you have any access to investors, partnerships, any partnerships in the health space, value-based clinics, we would be happy to talk and see how we can help, as well as mentors. If you're in the health space, have knowledge about value-based healthcare, that would be great, or how we can build our system and build our sales model as we go forward, as well as any customer acquisition recommendations that you have. Here's just an overview of the fundraising we're doing right now. A lot of it will be used to execute the pilots I mentioned above, as well as gather more clinical evidence as we look to scale and grow Oben. With that said, I want to thank you all for listening. Again, pardon background noise, and I hope you join us in reversing heart disease, and I'm open to any questions you have. Thank you.